Somebody.
And only 5 dentists in this out of 350 do pterygoids, and 2 of us are here at the clinic.
Yeah. What about pterygoids?
The pterygoids is also another great technique that we've learned from Dr. Holtzclaw and Dr. Juan Gonzalez.
You go to a certain place and you know you're gonna find this. You go to another place and you know you're gonna find this. But it's very hard to find all this in one place, and it's here. And just to correct you a little bit on what you said you do 1 to 2 all-on-4s in a week. I don't know who you're lying to, bro, because sometimes you've done 1 to 2 all-on-4s in a day. Go look at the x-rays that these guys are posting of before and afters. Look at the way these things are angled. They're not straight. They're angled for a reason. We don't do anglings because we're throwing gang signs or something like that. It's angled because it's going to be better for you. It's going to be there. We want them to be there for a lifetime.
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy tea up in the limousine.
Welcome back to Supremedental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Listen, this podcast was meant for you, our patients. Guys, we're on Spotify. We're also on Apple Podcast. You guys are more than welcome to go in there, and anything you guys would want to hear when you guys are driving or after you guys go with another dentist, just make sure you guys are well informed. This is why we do this podcast, man. We really do it for you guys. Today we have, once again, we have Dr. Luis.
Hi.
Dr. Ivan, a.k.a. Spooky. We have Dr. Elias G. Elias.
What's up, Frank?
Elias.
So, guys, there's a lot of things in my mind, and there's only so many things we can talk about in the next 20, 25 minutes. There's certain things that we shouldn't talk about. One of the things that I really want to talk about is let's talk about the all-on-4, all-on-6 procedures, okay? You guys do nasal floor lifts, transnasal floor lifts. You guys do pterygoid implants. You're going now to get coarse unzygomatic implants. We do immediate loads. We were just talking about that. And you guys make it look easy. Okay? Someone comes in here, and it's rare that a patient walks out without an option of having something permanent in their mouth. And if we couldn't do it, we always tell them, well, I think we had 1 or 2 cases, but I remember one specifically that we said, we don't do zygomatics and you need zygomatics. I said, we don't do them yet. And she said, well, you guys let me know when you do. I don't know if you remember that patient.
Yes. Mm-hmm. She's from LA.
So, tell me about these procedures, guys, because a lot of clinics here, and I'm going to talk about algodones because this is what I know. We've been here for close to 17 years already, and I know how the game works here, and I know that everyone tries to tell you that, my doctor can do an all-on-4. Oh, yeah, we can do an all-on-6 or whatever it is. But how extensive and how hard is the things that you guys are doing? Because now we see it as normal. Like we were just talking about it before we started this podcast. And every time we keep on moving forward with more technology and more experience and more knowledge and more, you guys just becoming better and better. But let's talk about the different things that we do and how complex they are. Because I've never met another place that can do all these things and also do crowns and also do veneers and also do it's like you go to a certain place and you know you're going to find this. You go to another place and you know you're going to find this, but it's very hard to find all this in one place, and it's here. So who wants to start on how complex are the things that we're doing and why it's not easy for other places to replicate Supreme?
Okay. Good question. Hi, somebody.
I'm sorry. I had a hi somebody. I like hi
Which
everybody.
is true.
I'm sorry. Yeah.
Hi whoever's
Somebody,
watching,
yeah.
hearing.
It's
I
true.
like
So
it.
somebody's there.
I
Right?
like it. I like it. I like it.
Okay.
I think it's great. It broke tension.
I like it. I like it. Yeah, I was kind of mad. Go for
Okay.
it.
It's because here we have a lot of patients. For example, in my time here, I do 2 or 3 Alan Ford every week. It's the experience. It's for the experience. Every patient is different. Every case is a challenge. For example, we can change the technique with the first patient. Do the second patient. I change. I don't know. For example, the angulation, or I change the abutment. I don't. It's because we have a lot of work. That's why we have a lot of experience in this process.
Yes and no.
This is the difference.
Okay.
Yes and no. I think experience is a
Yeah.
big factor. It's a big factor, but I've seen other places where they also have a lot of volume that their work is shit.
Ooh.
Yes, you can make this a lot of or very often, but you can do it wrong all the time.
Oh yeah.
Yeah.
So they don't learn from their mistakes.
No, I think the team that you have,
Yeah.
the level that we push each other as well. I think that we want excellent work, and I think you guys have done a great job. Aida and you have selecting the people that you want representing your team, representing your clinic, and I think you have found a way to actually find the dentist, and I think it all started with Luis. That's my honest point of view.
Thank
Always that I think it started with Luis, that his level of thinking what's right, his standard is very, very, very high.
Yes.
And it's always very, very high. And it started with him, and I think that's how that we all look at him as our standard. And if he asks himself that he's been here the longest, his work is very good, and he motivates the rest of us to do great work. And we're always pushing each other. So it's also the experience, but it's also the people that are here at the clinic are also very good.
Yeah.
Okay.
Yes, be surrounded by all the other specialists. Sometimes they're doing one case and you're looking, and you learn from all each other teammates.
And just to correct you a little bit on what you said you do 1 to 2 all-on-4s in a week. I don't know who you're lying to, bro, because sometimes you've done 1 to 2 all-on-4s in a day.
Oh yeah.
And then when he talks about all-on-4, he's talking upper and lower.
Up and bottom.
So
Yeah.
that's yeah. So an all-on-4 is like one arch. I mean, you're talking about all-on-4 top and bottom, and sometimes you've done 4. I mean, 2 patients top and bottom in 1 day.
or 3 patients every week, or two patients. Maybe 8 Alan Fords.
The
eight or
8
6.
all-on-4s means 4 patients.
Yeah, and yes.
Yes.
See?
Yes.
Yes.
You hit the nail in you put the nail in the coffin when you said that some clinics have a lot of work and they're still shit. You know, that's tough. That's hard, because I know that's true. And I think that it's a lot of the times it could be management, it could be them the owners, or it could just plain out be the dentists that don't care. You know, we see it as, obviously this is patients' lives. You know, this is people's lives that, you know, how many stories have we heard, guys? I had to sell this, I had to sell that, I've waited this long. We've heard people that said, you know, please give my son his smile back. You know, he's tried to suicide. You know, patients that have been try to take their lives away because they thought they had no options. Patients that even them being in the medical field, you know, their dentists have turned their backs on them, like Lori Tuck. And like the patient that you're working on this week from Canada, that they told her, no, you can't get it done or whatever. And because of your guys' hard work, this is able to be done. You know, this is able to be done. And let's talk about a little bit of the things you guys do that I believe it's a big connection. It's, you guys do so many things. Let's talk about transnasal floor lifts. What's a transnasal floor lift?
I think, yeah, a transnasal floor lift and all the techniques that we do have been pushed, because we see our standard is it's going to be the world level. We don't.
Okay.
It's not like, oh, what they do here in Los Algodones. No, we look at the top doctors, the top clinics, the top institutes, and we want to do their protocols. That's why we're traveling around the world to learn the best techniques, to learn what we're doing, what's the best at the moment. We're not a step behind. We're there. We have the technology, we have the patients, we have the dentists, we have the management, we have everything to be there. So all the techniques that we do, it's proven that that's the best outcome for you down the road. We always want to engage better bone. That's why we do nasal floor lifts, where we lift the mucosa of the nose to engage better bone on the maxilla. It's not as dense, but the floor of the nose, it's always
It's very hard.
It's very hard,
yeah.
and that's where we anchor our implants.
What's a nasal floor lift?
Okay, it's like a sinus lift, but it's on the nose. With this technique, we can move the membrane. It's a hard membrane, but what's the technique? For example, we can move the membrane. After this process, we can place the implant, but I need to prevent touch the membrane. That's why it's very, very important. Start first with the elevation.
What's the golden triangle?
The golden triangle is this little piece of bone that connects this part of the nose with this part of the maxilla.
Yeah.
And it's a very, very dense point that we have. And we always want to angle our distal implants to that point where we know we're going to get better torque.
What implant do you normally put on the golden triangle?
What implant as far as
What technique takes you to that?
transnasal? We do transnasal or transsinus as well.
Transinusal.
Transinus as well.
What about the palatal approach? What is that?
Okay. That's going to the back part of the maxilla to try to grab as more keratinized, ¿cómo se dice keratinized?
Keratinized, yeah.
Keratinized tissue. Because if part of the implant is exposed in the back, nothing happens if it's covered with the roof of your mouth, with the keratinized tissue. Covering with a 2 millimeter shell at least of bone in the front.
So palatal approach, that means you're going through the palate.
Yes.
So you go through the back.
That's going through the back.
Yeah.
For very thin maxillas.
So
Very thin.
back in the day, I remember saying,
Atrophic maxilla.
someone has a very thin bone. We can't do implants.
Yep.
Well, with the palatal approach, you can.
Yeah.
Yeah.
So we talked about the palatal approach. We talked about the transnasal floor lift. We talked about the nasal floor lift. And we talked about the
Sinus.
Transinus.
Transinus. Yeah, where we
Yeah.
move the sinus and we go straight
Yeah.
into the nose.
Okay.
Get more
Now-
cortical bone.
Let's talk about pterygoids. What about pterygoids?
Pterygoids, it's also another great technique that we've learned from Dr. Holtzclaw and Dr. Juan Gonzalez that they use. So the thing about the maxilla is that the bone is always very soft. But these doctors are always looking for better bone quality. The pterygoid implant, it's an implant that's going to be placed outside the maxilla. It's called extramaxillary implants. I think they're a higher level of difficulty, but you're going to engage better bone. It's to avoid sinus lifts, and it's also going to give you the minimum torque that it should give you is from 50 to 70, even up to 100 newtons.
Is that bone that's more connected to where your cranium?
Yeah, it's actually that's where it is.
Yeah.
So that's why that bone is stronger, it's harder.
Yeah, it's stronger, it's harder, and it's placed in an anatomy that it's very challenging. So you have to have a lot of experience placing implants to be able to place that implant. Because if you go too far to the right, you're gonna hit veins. If you go far to the left, you're gonna hit arteries. So,
arteries.
So and it's not it's a place where you're not seeing where you're placing.
It's because
the
you
implant.
cannot see it. You cannot see.
It's all about touch.
What more important, and what I've been doing my study is, and correct me if I'm wrong, is approximately less than 5% of the dentists around the world do pterygoids.
I think it's even less than that.
Yes.
5% of dent. I think only about, and I saw a study in the States that only about 10 to 15% of the dentists in the U.S. place actual implants. Out of that, I think out of dentists that do implants, I think only about 30% or even 20% do full arch. Full arch.
Full arch.
Full
No pterygoid
arch.
implants
No.
or
Out of people that do full arch,
full arch. Yeah.
I think only 5% Well, I could even reduce it to less. How many implantologists do we have here in Los Algodones? How many? Just
I'm gonna
100?
say no.
More.
You gotta say more. You're probably like 300, 350.
350 dentists do implants here in Los Algodones.
A lot of people do implants now.
Out of those, there's only 5 dentists in Algodones that do pterygoids.
So that'd be like what, 2%?
I'm really bad at math.
1 point something.
I don't know, 0.5% probably.
Be very little.
Let me check.
Well, 5 out of 100 would be 5%. So if we do it at 200, you'd be 2.5%. They say out of 300, so you're like 1 point something percent. Like probably less than 1%.
Less than 1%.
Less than 1%.
And this is a place where implants is a bread and
Yeah,
butter.
this is where dental's bread and butter.
And only 5 dentists in this out of 350 do pterygoids, and 2 of us are here at the clinic.
Oh.
Yeah.
Yeah, I seen Spooky walking around with the book.
Yes.
But
I'm reading that.
it takes a long, it takes more than reading books. It takes a lot of work. I mean, I don't know if when you guys decided to be dentists, you guys thought that you guys were going to be doing something like what you guys are doing right now. Was that ever in your mind? Like, I'm going to do pterygoid implants. Did you even think about doing implants?
I didn't even know what a
didn't even
pterygoid
know
implant
what-
was.
No.
No.
No,
And
we
now
don't even
your mind is, I want to do zygomatics and quad zygomas.
Yep.
Then what?
Brain transplants? I don't know.
Coming soon at Supreme Dental Clinic. That's crazy, guys. And the thing is, you guys, let's talk about immediate loads. Because immediate loads, like we were just talking about it, it's rare when a patient doesn't want an immediate load. Because why? The immediate load does better. The bone stimulation, the bone loss is way less. The patient walks out of here with something they can't take off.
Yep.
They walk out of here with a smile, and they can come back earlier to get their final work. And if it's with Strawman, they can come in within 2 months, 2.5 months.
10 weeks. Yeah.
So, I mean, it's a win-win for us because we have better bone when they come back. The patient, obviously, because it's their bone. And they're able to eat right away. No more grandpa, grandma denture flopping around.
Yeah, even now the protocols, dentures, like we shouldn't even do dentures. Like we shouldn't do dentures for all on 4s or for all on 6. It's not a good. It's not good for the implants overall, the gums or anything. And also another point that I wanted to touch, I forgot, was locators. That it's also shouldn't be an option.
Honestly. You mean like snap-in dentures or what?
Yeah, it shouldn't be an option. It's not good for the implants.
Well, no, because you're putting it's because the patients are taking it off, put it back on, and you don't know what force they're applying, or if they're going more from one side or the other, and then because of that movement, eventually, something's gonna mess up.
Yep, and also like the patients they have a false sense that they're gonna be able to eat like with something that's fixed, and it's not true. I mean, pretty much, like if you think about it, it's just 4 little rubber plastics that are holding onto the denture. The thing for the locators is the denture doesn't fall off.
Yes.
That's all it does.
It's just a little better than a regular denture.
Yeah, but
Not
you're not gonna be able
better.
to eat the same or anything. It's not that like it. We don't offer it. We shouldn't even like it's out of the protocols now that like it's
kind of
been
like the 3-on-6.
Yeah, like the 3-on-6.
Yeah.
Same thing with the 3-on-6.
See.
It's been proven. Sometimes like it's hard for us to explain the mechanical procedures of why it doesn't work. There's something called cross arch stabilization that helps all the implants. It's going to help. It's not going to become as loose. It's going to be better for the implants. But once you're here and we can actually explain to you the way how the bite works, how teeth move,
About
implants
distributing the weight of the bite.
workload. Yeah, it's a whole theory and law, I think. And there's studies out there that like if you go around the world with the top-notch dental institutes, and I'm talking about educational, they're not going to talk to you about 3-on-6. They're going to talk about
all on 6 maybe.
all on 6 and
yeah.
all
6.
in one structure.
Yeah. And it just it blows my mind because day by day, as you know, we see different clinics. One of the things that I really dislike is best in town. I hate when people say best in town. You know, I started seeing that with tacos here. It was best in town, best in town. Then I started seeing clinics saying that best in town, best in town. I don't care about being the best in town. Like, I want to be the best overall, you know, and I'm not saying we're the best overall, but if we're not, we're working every day to get better. Every single day we see something different. Every single day. A week doesn't go by when we're not talking about something else. Like, what are we going to do this? What are we going to do that? Oh, well, I found this training. Well, I found that training. Well, what about this? Elias came back from his vacation and he like, hey man, I already found what brand of implants we should use for Sigomatics. Here's the guy's number. Here's the packages. It works with these multi-units that we have. We could even create ones that better angulation. And I mean, it's you guys love what you guys do. And it just blows my mind. Like I said, clinics that are out there and they're trying to lie to patients. Like, if you can't do something, just don't do it. Mm-hmm. That's it.
Yeah.
Don't do it for the money, because being a good business person, if you're doing something wrong, it's going to come back. And it's going to come back bad, because you're going to have to then fix it, or it's going to give you really bad publicity, and you're going to burn bad bridges. And people here don't seem to understand that. Like, they keep on lying to patients. Not too long ago, we secret shopped someone, and they said that there's 2 other clinics that they recommended on top of us here in Algodones. And you add those 2 clinics together, you put them both together, and they don't have half of our accreditations. Not even half. You add both of them together, and they haven't even been open half of what we've been open. You know, how do you say that they're better than us? You know, how do you say that? I mean, I don't get it. And patients obviously are misled by this. And when you guys talk about pterygoids, palatal approach, transnasal, nasal, transsinus, immediate loads, and they can't do it, they're going to say, that's too aggressive. Mm-hmm. That doesn't work. Listen to here. Let me do a sinus lift.
It's dangerous.
And wait 4 to 5 months or 6 months and see if you have enough bone, so then I can do your implant, a little short implant that's straight, because they don't know much about the way you angle the implants. Like I've told everyone before, look at the X-rays. Go on Instagram. Go look at the X-rays that these guys are posting of before and afters. Look at the way these things are angled. They're not straight. They're angled for a reason. We don't do anglings because we're throwing gang signs or something like that. It's angled because it's going to be better for you. It's going to be there. We want them to be there for a lifetime. We're the last ones that we want you to come back because something falls off. And other places don't see it that way. And we see that every single week, month. We hear horror stories, and everybody's better than everybody else. And that's a shame. That's a shame. But we can only control the controllables. And I told you guys many times, like, we're not going to cut corners. I'm not going to throw shade on anybody, but we just started a lab, and very happy. We are working on, hopefully in the next month or so, we're going to do a big video on it, you know, when everything is ready to go, month and a half. Mm-hmm. And I'm starting to notice other things in other labs that I didn't know. And it's because it was in my field. And I'm just like, wow, like I didn't think that this lab used this material. I didn't think they used Chinese materials. And it's sad because the mentality is, well, we'll do that. We'll put some nice ceramic makeup on and we'll make them look nice, and the patient leaves. And then, you know, it works out. And then in a couple of years, 5 years, 4 years, 3, it breaks.
It breaks, yeah.
We blame it on the patient. We give them a 3-year warranty. It's over their warranty. They have to repay it. And we're ready to go. And I thought that these places were really, I thought they were really, they really cared. And obviously we're going to work with the best. And obviously it's going to cost us more money to do it. But hey, we know that it's going to be the best for the patient. And we know it's going to be the best for us too, because it's not going to break. I mean, it still might break, but it's not because it's cheap.
Yep.
You know what I'm saying? And as a business person, normally you would say, well, we could sell them something cheap, and then if it comes back, the warranty is cheap too. I mean, who cares? But then I've said it before. It's a business. It's a medical business. But when the business takes over, the medical is just a business, and we will never, as long as I'm part CEO here at Supreme Dental, that will never, ever happen. So I just wanted to let it out there, guys, and I wanted to talk to everybody about this, is that what we do at Supreme, you see these guys walking around laughing, talking, hey, what's up? You see this guy with Buzz Lightyear Crocs and the Woody Crocs.
Woody Crocs, yeah.
And you see this guy with the little dinosaur because he's Rex, but the Rex doesn't have one yet. And guess what? Everybody's like, oh, these guys are cool. You see the podcast, you see the funny, you see us trying to dance a Thriller, and watch out for this Halloween. It's going to be crazy. And you say, oh, those guys are cool, man. I mean, there's not a week that goes by, guys, that somebody doesn't approach me, or many patients approach me and say, hey, I want to thank you for what you guys are doing. You guys are doing a great job. You guys really focused on me. You guys really focused on this. Some patients did wait a little bit longer, but when we got to them, we gave them our all. And we didn't like something, we returned it, and that's it. And you guys work long hours. Nobody forces you guys to work long hours. And I want to make this straight, because patients tell me, Frank, don't work your dentist so much. I don't work them. These guys don't leave, except Spooky. He wants to leave. But besides that, everybody else doesn't leave. Like, I'm like, Luis, go home. Like, Elias is like, oh, my God.
I am happy here.
Oh, it's 8 o'clock. We're not, man. Let me tell. No, man, go home. Like, and so, I want to say thank you to you guys, because you guys, it's like having a real product. You guys are not made in China, Yeah. So that if we don't want our zirconia discs, if we don't want our material to be made in China, because we know the quality is not there. It's the same thing when you guys are working with our patients and you don't want them just to hurry up and just get them out, because you guys also are not cheap, and you guys also value your work. So anybody out there that tells you, hey, you know what? Yeah, no, don't do that. No, do your research. First of all, if you're not going to come to us, I mean, it is what it is, but don't go to that clinic, because they're not going to do what's best for you. They're not going to do what's best for you. And at the end of the day, it's not a car part, it's your health. So, thank you so much once again, guys, for being here.
Thank you.
And thank you for doing what's right. And sometimes, even when we do what's right, sometimes things just don't come out the way we want them to.
Yep.
And sometimes things come out way better than we thought it was going to be. But we're here for your dental journey from the beginning to the end. From our receptionists, from our drivers, to our dentists, to our assistants, my wife and I, to our amazing patient coordinators, and agencies that do their job correctly and follow up with patients and make sure that you guys are 100% always on what you guys are getting. And we want to thank each and every one of you guys for being part of the team. Thank you so much. George is falling asleep. He's sweating too. Are you okay, bro?
He played soccer yesterday.
He plays. Well, actually, he's in my soccer team at Supreme. And he plays like 5 minutes, and then he's sore for 2 weeks. But thank you so much for being here, guys. Thank you so much for being part of Supreme Dental. This has been Supreme Dental Podcast Studio, powered by Supreme Dental. And make sure wherever you go, they make you keep on smiling.
Thank you.
And if you don't know, now you know.
That's right.
And if you don't know, now you know.